Mr. President, I'm going to make my comments now and talk a little bit about what people have said today, but also to hopefully blunt a few of the myths. Mr. President, I want to thank my freshman colleagues who have spoken this morning. It's truly wonderful to hear the many different ideas and innovation about the reforms that are already working and about the new proposals that will help us achieve the overall goal of reform. Tens of millions of more Americans covered, with access to more choices and premiums that individuals and small business can afford. In these final few moments of my time, I want to preempt what may come on the floor from the other side of the aisle later today, from those who will have listened to these presentations about innovation and excellence. They are likely to respond the way they have always responded to reform ideas, by just saying no. The bill is still being written, but we've already seen the tactics of the other side. They say this is purely partisan exercise and that the Democrats are not listening to Republicans. They bring a big, thick mock bill to the floor and say it's too big and we'll never read it. They say the bills need to be on the internet or democracy is somehow in jeopardy. Mr. President, with all due respect to my colleagues on the other side, the Republicans, I beg to differ. For starters, I brought my prop, and actually it's not even a prop, it's the real deal. When I look at this is what I'm holding, is the actual Republican amendments that were accepted to the health bill. 161 amendments, 300 pages. 300 pages of the 700-plus page bill. Almost a third came from them. And this is the stack that doesn't include the additional Republican amendments accepted in the Finance Committee. Again, these are not proposed amendments. These are the Republican amendments that were accepted and reported out of the Health Committee. I have two questions, Mr. President. First, are the critics of health reform saying that the size of the eventual bill really matters? That the Senate leadership somehow be embarrassed because a major piece of legislation that will affect 1/6 of our entire economy isn't offered in some big type cliff notes? We're already hearing that. And by the way, all the committee bills have been on the internet for weeks, and in some cases, months. And the merged Senate version will be on the internet. And so will the final bill from the conference committee after the House and Senate work on their differences. My second question is this. I wonder how many of my colleagues across the aisle have actually read these Republican amendments, because there are some very good ideas. I know the Republicans are quick to say the committee only accepted technical amendments, but that doesn't appear to be for all cases. An amendment by Senator Burr says the Health Committee's community health insurance option must follow state insurance regulation. This is not trivial. It refers to important matters like solvency, consumer protection, and much, much more. The amendment helps to ensure a level playing field between the public option and all the other health plans in each state's insurance market. That's hardly technical. Or the bipartisan amendment supported by Senators Gregg and Enzi and Alexander. It all allows employers to give bigger incentives to employees who participate in workplace wellness programs, which I think is a great idea, something I implemented when I was the mayor of Anchorage, Alaska. My own Alaska colleague, Senator Murkowski, added another good idea to the health bill, like improving student loan repayments to health professionals who agree to work in medically underserved areas. Another very good idea. I hope my point is clear, Mr. President. There is lots of reading to be done by all of us, and there has already been good work by members on both sides of the aisle. So let's talk about the merits of health reform. Let's debate the policy. Let's lay out our legitimate differences and then work together on solutions. Mr. President, my freshman colleagues have described it well over the past hour. When it comes to reform, there are many examples of excellence already underway. We need to support such innovation, expand it, and make it part of a nationwide effort to give all Americans access to health insurance and basic medical care. There is still time for all of us to work together. We need health insurance reform now, and we know it will work.